Imagine a horse, galloping across a field, clearing a jump, just effortless grace. It's really a breathtaking display of athleticism. And right at the heart of all that power, that precision, are its lower leg joints. They're kind of the unsung heroes, really. The foundational architecture, enabling everything from a gentle trot to that incredible leap. Today, we're taking a deep dive into equine distal limb joint disease. We're going to zero in specifically on conditions affecting those crucial lower leg joints, what people often call the pastern and coffin joints, and also a really prevalent issue known as ring bone. Our mission, really, is to pull out the most important insights from the sources you've shared with us, give you, the listener, a shortcut to being well-informed about what can be, let's face it, a pretty complex topic, hopefully provide some aha moments without just, information overload. Okay, so let's unpack this. When we talk about distal limb joints in horses, we mean the architecture that lets them move so powerfully. But what specifically are these joints we're focusing on? What makes them so vital, but also maybe so vulnerable?
Yeah, that's exactly the right place to start. So when we look at the horse's limb, it's this incredibly complex system, right? And we tend to categorize the joints sort of from the top down. You've got the carpus, that's the knee joint, essentially, and the tarsus, which is the hock. Then below those, you get to the fetlock joint. And then further down still, you find the pastern and the coffin joints. And for today, yeah, we're really homing in on those last two. The pastern joint, technically it's called the proximal interphalangeal joint, or PIP for short. It's actually considered a low motion joint, doesn't have a huge range of movement. Then you have the coffin joint. That's the distal interphalangeal joint, or DIP. Now, this one, maybe surprisingly, is a high motion joint. And what's really fascinating here, it's located entirely within the hoof capsule.
Oh, entirely inside the hoof. A high motion joint.
Exactly. It seems counterintuitive, doesn't it? This dynamic joint encased in the rigid hoof. But it's an evolutionary marvel, really. Allows for incredible shock absorption. But, like you hinted at, it also means problems there are literally hidden. Makes them really complex to diagnose and to treat. You often get these subtle lamenesses that are easy to miss early on. It really is kind of the black box of equine anatomy. Both of these joints, the PIP and DIP, they're supported by this network of structures, strong collateral ligaments on each side for both. And the PIP joint gets some extra support, too, from palmar and distal sesamoidean ligaments.
That black box idea really sticks. It does make you wonder, if these joints are so critical and so hidden away, what actually happens when they start to, break down?
That's the key question, isn't it? Because the most common cause of lameness we see in horses is osteoarthritis. OA, or sometimes called degenerative joint disease, DJD. It's basically a progressive condition. It involves the breakdown of the articular cartilage, that smooth, shock-absorbing surface on the ends of the bones. And you also get remodeling of the subchondral bone, which is the bone just underneath the cartilage, and inflammation of the synovial membrane, the joint lining itself.
Okay, so when OA hits these specific lower leg joints, is there a more common name, something owners might actually hear their vet use?
Oh, absolutely. Yeah. When OA affects the pastern or coffin joints, it's very commonly known as ring bone. And just to be clear, if the OA is in the coffin joint, the DIP, that's called low ring bone. And if it's the pastern joint, the PIP, that has the osteoarthritis, then it's called high ring bone.
Ah, okay. Low and high ring bone. That makes sense. So what actually causes this ring bone? Are there specific things that put a horse more at risk?
Right. The causes, the risk factors, they're often multifactorial. It's not usually just one thing. I mean, high-impact sports are an obvious factor, sure. But a key insight here is how subtle repetitive stresses can build up. Things like constant circling.
Circling, like in training.
Yeah, exactly. Or even just improper shoeing, feet that aren't balanced right. These things seem minor on their own, maybe. But over time, they accumulate and create significant degenerative changes. It's often that death by 1,000 cuts idea rather than one big injury. We also see links to working horses on uneven ground or just generally unbalanced feet from, poor hoof care, poor conformation, how the horse is built, and existing hoof imbalances. They're definitely significant contributors. And certain sports, things that demand repetitive, quick turns, abrupt stops, think Western disciplines, polo, jumping, they place huge stress right on those joints. Age is a factor, too. It's most common in middle age to older horses just from that accumulated wear and tear. And sometimes other conditions can predispose a horse, things like osteochondrosis, where cartilage development goes wrong, or even old, maybe minor fractures within the joint.
Okay, so if we start suspecting an issue, maybe the horse just isn't performing quite right or seems a bit off. What are the first clues? What might stand out to us?
Well, the main sign is usually lameness. And it's often chronic, kind of creeps up on you, maybe progressive. It can be quite variable too. Often one limb is worse, but sometimes it can affect both. The lameness frequently gets worse when the horse is circling or working on hard ground. That's a classic sign. You might also notice the horse resents having that lower limb flexed during an exam. They just don't like it. Visually, sometimes you can see swelling, maybe a distension, like a fluidy swelling on the front of the coffin joint area. Or in more chronic cases, you might feel a firm, almost bony-like swelling around the pastern joint for high ring bone. There's also a very specific sign in really chronic advanced coffin joint disease, something called buttress foot. You actually see this distortion, a bulge on the front of the pastern or the hoof wall, like the body's trying to shore things up.
Given how varied those signs can be, sometimes subtle, how do vets really figure this out? Sounds like real detective work, especially if those obvious visual changes only show up late in the game.
It really does require a systematic approach. Absolutely. It always starts with a thorough history, getting all the details. When did the lameness start? How long has it been going on? What's the horse's job? Any previous injuries? All that background. Then the physical exam. Looking at how the horse stands, how it moves, carefully feeling for any heat, swelling, or specific pain points, and a really good hoof examination is critical. The next step is the lameness exam itself. Watching the horse walk, trot, straight lines, circles on different surfaces, hard ground versus soft ground often tells you a lot. And flexion tests are important here too. Bending the joints can help highlight or exacerbate the lameness, giving us clues about the general area of pain. Then, to really pinpoint the pain source, we often move to diagnostic anesthesia. Nerve blocks, like the palmar digital nerve block, which numbs the back part of the foot. If the horse goes sound after the block, it tells us the pain is coming from that numbed area. Or we might do intra-articular blocks, injecting anesthetic right into the suspect joint. That's usually very precise. One little caveat, though. The nerves down there run really close to the coffin joint capsule. So sometimes a nerve block can accidentally numb part of the joint, too, just by diffusion. Makes interpretation a little tricky sometimes.
Right, so you've narrowed down the area. How does technology help you actually see what's going on inside that black box?
Yes, imaging. It's indispensable, really. Radiography x-rays, that's often the first step. We're looking for bony changes. Things like osteophytes, those little bone spurs.
Bone spurs, right.
Yeah, or maybe the joint space looks narrower than it should, or the bone underneath the cartilage looks denser, that's subchondral sclerosis. Or sometimes you find actual fractures or little OCD fragments floating around. And this is important, x-rays can look completely normal in early cases or acute ones, even if the horse is clearly sore. So a normal x-ray doesn't rule out a problem.
Okay, so x-rays aren't the whole story. What else?
Well, then there's ultrasonography. Ultrasound is great for looking at soft tissues, things like the collateral ligaments, the joint lining, any excess fluid effusion in the joint. But honestly, for the foot and the distal limb, magnetic resonance imaging, MRI, is really considered the gold standard.
MRI, okay. Why is that so much better?
It just gives incredible detail of everything. It shows soft tissue injuries brilliantly, like damage to those collateral ligaments, or maybe the deep digital flexor tendon within the hoof capsule, which you just can't see well otherwise. It also shows subtle bone problems like bruising or early stress reactions in the subchondral bone and lesions that x-rays just miss completely. You can do MRI with the horse standing sedated or under general anesthesia, depending on the situation. We also sometimes use nuclear scintigraphy, a bone scan. That's helpful if the lameness is really obscure, maybe involving multiple limbs. It highlights areas where bone is actively turning over, indicating inflammation or remodeling. And lastly, if we suspect an infection like septic arthritis, we can take a sample of the joint fluid itself, synovial fluid analysis, look at its appearance, count the cells, especially neutrophils, and culture it to see if bacteria grow.
Wow, okay. So once you've gone through all that detective work, solved the puzzle, got the diagnosis, what's the plan then? What does treatment or, management look like? It definitely sounds like there's no single magic bullet here.
No, you're absolutely right. It's very much a multifaceted approach. A cornerstone really is rest and controlled exercise. Sounds simple, but it's essential for allowing things to calm down and heal. That can mean anything from strict stall rest initially to gradually increasing controlled hand walking. And hoof balance and shoeing. Absolutely crucial. You have to address the mechanics. So restoring correct hoof balance, maybe shortening the toe to help the foot break over more easily. These things directly reduce the damaging forces on the joints. It's vital for long-term management. Then you have the pharmacological therapies, the drugs. Systemic NSAIDs, nonsteroidal anti-inflammatories like phenylbutazone, are commonly used to reduce pain and inflammation body-wide, at least initially. Then there are intra-articular or IA medications. injections right into the affected joint. Corticosteroids like methylprednisolone acetate or triamcinolone are really potent anti-inflammatories for use inside the joint. And sodium hyaluronate, HA, is often used too. It acts sort of like a joint lubricant and also has some anti-inflammatory effects. Quite often, vets will use a combination of a corticosteroid and HA in the same injection, but, and this is a really critical warning, you absolutely do not want to inject corticosteroids into the joints of a horse that has laminitis. It's a big no-no.
Okay, that's a really important caution. What about other types of medications?
Yeah, there are systemic chondroprotective drugs. Things like polysulfated glycosaminoglycan PSJs. Equine is a common brand, or intravenous HA. These are given by injection, usually intramuscularly or IV. The thinking is they help protect the existing cartilage, maybe inhibit enzymes that knock it down, and possibly stimulate some repair. And of course, many owners use oral joint supplements like glucosamine and chondroitin sulfate. The evidence for those is maybe more variable, but they're very popular. And moving beyond drugs, we're seeing more use of regenerative therapies. Things like platelet-rich plasma, PRP, or IRAP, or even stem cell therapy. These are all aimed at trying to stimulate more natural healing within the joint environment. Still evolving fields, but offering new possibilities. And then there are surgical options, usually reserved for more advanced or specific cases. Arthroscopy, keyhole surgery can be used to clean out a joint, remove bone fragments, that kind of thing. For really severe chronic osteoarthritis, especially in that low-motion pastern joint, the PIP, surgical arthrodesis joint fusion is actually a pretty significant procedure.
Joint fusion, that sounds drastic.
It is, but by fusing the joint solid, you eliminate the painful movement. And because the PIP is naturally a low-motion joint anyway, many horses can actually return to athletic work, even jumping, after a successful fusion. It basically removes the source of pain. It's done much less often for the coffin joint, the DIP, because that's such a high-motion joint. Fusing it has bigger consequences for overall limb function.
Right. So looking at the bigger picture,
Yeah.
what's the long-term outlook for a horse diagnosed with this? And maybe more importantly for people listening, what can we actually do to try and prevent these problems in the first place?
Yeah, the prognosis is highly variable, really depends on how severe the arthritis is, which joint is affected, the horse's job, lots of factors. But it's important to be realistic. Both DIP and PIP osteoarthritis are generally progressive conditions, so some reduction in athletic soundness over time is unfortunately expected. That said, catching it early and starting treatment promptly can definitely help prolong the horse's useful career. And as we just discussed, for those chronic advanced PIP cases, surgical fusion can offer a good prognosis for returning to work, which is pretty amazing. But advanced DIP disease, low wing bone, that often does lead to chronic lameness and might mean retirement from strenuous work. A common outcome, or complication if you like, is simply that the horse can no longer comfortably perform at the level expected for its sport. So, prevention. This is where we can potentially make the biggest difference, right? If a horse is diagnosed, sometimes just reducing the workload or switching to a less demanding discipline can significantly slow down the progression. Thinking even earlier, proper conditioning and training programs are key. Avoiding overtraining, especially in young horses. Balanced nutrition is huge, particularly avoiding really rapid growth spurts in youngsters, as that can contribute to developmental orthopedic issues. And I know we mentioned it with treatment, but regular correct hoof care by a really skilled farrier, it's non-negotiable for prevention too. Proper balance is fundamental to joint health. Thinking about footing, working horses on appropriate surfaces, minimizing excessive concussion. Weight management is also important. Extra weight just means extra stress on those joints day in, day out. And really, critically, just being vigilant. Early detection. Paying attention to subtle changes, any sign of lameness or swelling, and getting prompt veterinary attention. That gives you the best chance of managing things effectively long term.
We've certainly covered a lot of ground today, journeying through the incredible complexity of that equine distal limb, uncovering the challenges of conditions like ring bone, and looking at that blend of sort of traditional care and cutting-edge science that helps manage them.
It really does raise an important question, I think, for you, the listener. When you consider the progressive nature of these conditions, how do we, as the people who care for these animals, as enthusiasts, how do we balance that drive for peak performance with the long-term well-being and ultimately the comfort of these incredible athletes?
That's a really insightful question to ponder. We certainly hope this deep dive has given you a clearer picture of these common equine health challenges and maybe, hopefully, empowered you with a bit more knowledge to make informed decisions for your own horses, or even just deepened your appreciation for the amazing complexities of equine health and their resilience. Thanks so much for joining us.